sex addiction cycle. We will also begin to understand the belief system for those individuals struggling with sexual addiction. Before we talk about what sex addiction is, let's talk about what are our current stereotypes of sex addiction. Who do you think sex addicts usually are? How do sex addicts behave? And what might lead someone to have a sexual addiction? Scott Vogel wrote about a couple sexual addiction stereotypes that are common. First one is the myth and stereotype that only men can be sex addicts. However, it's very inaccurate. Although women may participate in less sexual activity and consequences to be considered a sex addict, they still can become sex addicts. But we will talk more about this later. The next common stereotype is that sex addiction isn't really a real addiction. While we still have issues convincing people of the science behind even alcoholism, being an addict to a process addiction like sex is even more of an issue. People are more convinced that sexual addiction is a problem of lack of morals or ability to control their desires. Even the psychological field, or APA, has not put sexual addiction into the DSM, even though there is some research that supports how sex addiction can impact the brain. We will learn throughout this lecture how sexual addiction is very similar to drug and alcohol addiction, even when it comes to how the brain begins to see that as survival. The next stereotype is that sex addicts love sex and sexual activities. And this one might be hard to grasp because most adults naturally enjoy sex and sexual activities, and it is reasonable to say, well, sex addicts must just love sex more than the regular person. But this is actually not the case. It is actually a compulsion similar to the use of drugs and alcohol. And when the compulsion for sex becomes evident, it causes a lot of pain. The last one is that the sexual addiction is just an excuse for inappropriate behavior. And while this may be the case for some individuals, especially in the media, or when someone has had an affair, using this as an excuse. However, sex addicts are real, and it's not an excuse for inappropriate behavior. So what is sex addiction, if it is not these stereotypes? Well, let's look at what a common definition for addiction is. For alcoholism or drug dependency, the person has a pathological relationship with a mood-altering drug. Well, for sex addicts, just substitute a sick relationship, an event, or a process for a healthy relationship with others. The addict's relationship with a mood-altering experience becomes central to their life. Sexual addiction is persistent and escalating pattern or patterns of sexual behavior that are acted out despite their negative consequences to self or to others. The diagnostic criteria. Sexual addiction or hypersexuality is not actually diagnosed in the current DSM-5. However, there are diagnostic models that have been accepted as appropriate diagnosis for sexual addiction. These were originally established by Dr. Carnes. First is that the sexual obsession or fantasy becomes the primary coping skill for that individual. The sex behavior is an organizing principle of their everyday life, meaning they organize their entire day around that sexual behavior. They use an extreme amount of time for planning or doing or recovering from that sexual behavior. This is a similar criteria for alcohol or drugs. Their behavior is in excess of what it was intended. So they might intend to just watch pornography for 30 minutes, but they end up spending 4 hours watching pornography. They have severe mood shifts, including sexual acting out. Their patterns are escalating in behavior and in frequency. And their pursuit of self-destructive or high-risk desire. Their desire or attempts to limit sexual behavior are unsuccessful. They have the inability to stop having those sexual activities despite all of the consequences that are occurring. Their pattern is out of control. The pattern of out of control sexual behaviors lasts for longer than 2 years. The pattern of alternating excessive control and out of control behaviors is over 5 years. So there might be time where they are very controlling over their sexual behaviors like sexual celibacy or anorexia. And then their out of control behaviors of sexual binges. They continue this off and on, and this lasts for about 5 years. They have severe consequences due to their behavior, legal, financial, relationship consequences. There is a presence of hierarchy of acting out behaviors. So they might start small and in order to give themselves a little treat, but then it becomes large. They begin to miss out on social, work, and family activities. And there's a presence of 3 of the associated conditions. They experience shame, depression, alcohol or drug abuse, victim of sexual abuse, victim of other kinds of abuse, physical. They lead a double life. They've been nurtured, sexualized. They've either had few or no non-sexual relationships, suicide ideation, denial, or even codependency. The following assessment is a good tool to use to identify sexual addiction. This is from the Sex Addicts Anonymous recovery website, and it helps to determine sexual addiction. The first question is, do you keep secrets about your sexual behavior or romantic fantasies from those important to you, or do you lead a double life? Have your desires driven you to have sex in places or with people you would not normally choose? Do you need greater variety, increased frequency, or more extreme sexual activities to achieve the same level of excitement or relief? Does your use of pornography occupy large amounts of your time and or jeopardize your significant relationships or employment? Do your relationships become distorted with sexual preoccupation? Does each new relationship have the same destructive pattern which prompted you to leave the last one? Do you frequently want to get away from your partner after having sex? Do you feel remorse, shame, or guilt after a sexual encounter? Have your sexual practices caused you legal problems? Could your sexual practices cause you legal problems? Does your pursuit of sexual fantasy conflict with your moral standards or interfere with your personal spiritual journey? Again, this goes back to, it's not a level of frequency that we're looking for, but whether it's a level of problematic. We often find that in religious individuals, they might feel that even a little bit of that frequency is a problem, whereas other people, spending money on an escort is not problematic at all. Does your sexual activities involve coercion, violence, or the threat of disease? Has your sexual behavior or pursuit of sexual relationships ever left you feeling hopeless, alienated from others, or suicidal? Does your preoccupation with sexual fantasies cause problems in any area of your life, even when you do not act out in these fantasies? And do you compulsively avoid sexual activity due to fear of sex or intimacy? Does your sexual avoidance consume you mentally? Many of the questions represent criteria mentioned in the previous slides. Some of the out of control and repetitive behaviors that may reflect sexual addiction can include excessive masturbation, simultaneously or repeated sequential affairs, excessive use of pornography, cyber or phone sex, multiple anonymous partners, unsafe sexual activity, sexualizing or objectifying your partner, strip clubs and adult bookstores, using or participating in prostitution and sexual aversions. Participating in one or more of these behaviors does not automatically mean sexual addiction, because the importance of sexual addiction is using despite consequences. The consequences that may result from sexual addiction and indicate the existence of a sexual addiction include social, or when an addict becomes lost in their sexual preoccupation. This can result in emotional distancing from their loved ones, loss of friendships, and family relationships. Emotional, this experiencing anxiety or extreme stress are common in sex addicts who live in constant fear of being discovered. Shame and guilt increase as the sex addict's lifestyle is inconsistent with their personal values and beliefs. Feelings of boredom, fatigue, and despair are inevitable as addiction progresses, and the ultimate consequence could be suicide. Physical consequences include diseases that can occur due to sexual addiction behaviors like genital injury, cervical cancer, or STDs being the most common. They may place themselves in dangerous situations that can lead to sexual assault or even death. Legal consequences might be in result to sexual addiction behaviors that result in the violation of law: sexual harassment, exhibitionism, voyeurism, prostitution, rape, or even child molestation. Again, not all sex addicts will progress to this level or to this point, but and not all of these behaviors are perpetrated by sex addicts. Financial and occupational consequences can result as they can be in debt from the cost of prostitution, phone, or sex, or affairs. They can also have to deal with legal fees or the cost of divorce and job loss due to missing work to participate in these activities. There's also spiritual consequences. Because sex addiction can be very lonely, it can cause resentment, self-pity, and even self-blame. All of these consequences are usually progressive and predictable. However, the addict is usually minimizes the consequences or blames others. Addicts begin this process with core beliefs about themselves that affect how they perceive reality. Our belief system is our model of the world. It is how we plan and make decisions, interpret other people's actions, make meaning out of life experiences, solve problems, our partner patterns of relationships, and develop careers and establish our priorities. But for the addict, their core belief tells them, I'm not a worthwhile person. People don't care about me and cannot meet my needs, especially if they knew about my sexual addiction. Sex is the most important need. Sex is a sign of love, and sex makes the isolation bearable. With these core beliefs comes impaired thinking. This faulty thinking comes with denial, which, as we talked about, is the ignoring, blaming, and minimizing of their consequences. There is often arguments, excuses, justifications, rationalization, and circular reasoning. And sometimes they can be sincere delusions about their actions and the effects on others. Dr. Carnes illustrates the addiction cycle that most sex addicts go through. The addict progresses through this cycle, and each time they repeat it, it becomes more intense. The first two phases of this cycle are preoccupation and ritualization, which are not normally visible symptoms. The addict does struggle to present an image of normalcy to the outside world. The public self is their false ego. With preoccupation, the addict's mind is obsessed with thoughts of sexual behavior. So, for example, a sex addict might think continuously about looking at pornography, wanting to look at it, wishing they could look at it, dreaming about it, planning it. This preoccupation often leads to ritualization. These are the routines that occur and lead them to the sexual behavior. For example, if a sex addict knows that they can get pornography magazines at a specific gas station, they might drive by that gas station on their way to work, and then that can escalate to going in and stopping at the gas station but not going in, and then escalating to going into the gas station but not picking up the magazines, and then again going in until they do pick up the magazines. Each of these rituals intensify with repetition and aids in the preoccupation or rush of excitement. The end goal of preoccupation and ritualization is the sexual behavior or the act. As I said, each time the cycle is repeated, it intensifies. So while the first time around the sexual behavior may just be masturbating, the next time it could be a one-night stand or prostitution and so on. The compulsive sexual behavior stage leaves a trail despite the intention of protecting their public image. For example, they might miss work to participate in their sexual behavior all day, the cost of hiring escorts, and so on. The last stage is the feeling of despair, shame, and guilt. This is represented as a low phase or a sense of failure, self-pity, self-hatred, suicidal feelings, and shame. They feel hopeless and powerless. This often leads them back to preoccupation, as preoccupation can provide a relief from that low feeling. So the addictive system starts with the faulty belief system. These assumptions and myths lead to impaired thinking, which perpetuates the four-step addictive cycle. This cycle is repeated and begins to take over the addict's life, making their life unmanageable. Keeping the secret life from the attention of their public life becomes unmanageable. Everything becomes focused on maintaining things, and things will slip. The addict's isolation becomes their worst consequence. As they lead this double life, they begin to distance themselves from their family and friends, and eventually there is no public life to maintain. The negative consequences for this unmanageability confirms these faulty assumptions in their belief system, which again perpetuates the entire system from occurring. Sex addiction is often combined with other addictions or mental illnesses. Carn's book talks about this, but some of the more recent numbers show that co-occurring issues are often present with sex addicts. In fact, more than 50%, and some of the studies even show 80% of sex addicts have additional addictions. 47% of sex addicts also struggle with an eating disorder. 31% struggle with alcoholism, 58% struggle with drug addictions, 29% can struggle with gambling, 49% struggle with compulsive spending, and even 37% struggle with addictive video gaming. And unfortunately, treatment for one of those addictions does not necessarily help the other one all the time. Emotional illnesses also occur with sex addiction. These can include anxiety, depression. In fact, depression and anxiety are known to be very highly comorbid with sex addiction. 39 to 73% have a history of depression or bipolar, and 42 to 96% have a history of anxiety. Sex addicts can also struggle with personality disorders. About 90% of sex addicts showed signs of suffering from a personality disorder. This can include dependent personality, borderline, love addiction, PTSD. So that ends this part of the lecture, and then the next lecture will go over the levels of sex addiction.